Welcome to your guide to forehead or brow lift surgery. Take a few minutes to familiarize yourself with the procedure and what you can do to help improve your results. Remember, this presentation does not take the place of your consultation, and you should make sure to jot down any questions you may want to ask us later. A brow lift is a popular procedure, especially for men and women wishing to reduce wrinkles and return a more rested, youthful look to their foreheads. It is often performed in conjunction with a facelift, eyelid surgery, dermal fillers, and/or skin treatments. Procedure: how will your forehead lift be performed? There are a number of different options to help tailor your procedure to your specific needs. The endoscopic forehead lift is a technique that utilizes 3 to 5 incisions within the hair, about 3/4 of an inch in length, so that a miniature video camera called an endoscope can be inserted beneath the skin. The forehead skin is lifted and repositioned but not removed, and the muscles of the brow are partially resected. Your eyebrows will be lifted and secured into their higher, more youthful position. The mid-scalp or hairline lift technique is commonly recommended for people with high hairlines or high foreheads. With this technique, the incision is made at the junction of the forehead skin and the hairline and runs over the top of the head from side to side. This avoids raising the hairline any higher when elevating the brow area. The lateral brow lift focuses on improving the lax skin and crow's feet around the outer sides of the eyebrows and eyes. The incisions are placed behind the hairline at the temples, and excess skin is trimmed. Upon completion of the procedure, the incisions are closed, your hair and forehead are washed, and in some cases, a bandage is applied. Together, we will select the technique that will provide the best result for you. When you meet with our patient coordinator, we will discuss fees and costs. Preparation: every person has a unique perspective on beauty, and your goals will affect the way your brow lift is performed. It is important to discuss your desires and listen closely during the consultation so that you can set realistic expectations. A great result can only be achieved when there is good communication between us. Some suggestions to help you prepare for surgery. Your safety matters to us. You should be very open. Provide your medical history, drug allergies, list any previous surgeries or biopsies, medications, diet pills, vitamins, and herbs you are taking, even if you don't think they're important. Also, don't be afraid to be frank with us about your lifestyle, smoking, the strenuousness of the work you perform, your exercise habits, and the importance of getting back to work. Here are some tips that will help you reduce scarring, shorten your recovery time, and decrease your chances of complications. Discontinue using aspirin, ibuprofen, naproxen, St. John's wort, and vitamin E for 1 week before and a few days after your procedure. These act as blood thinners and could cause problems with blood clotting. Stop smoking and drinking alcohol in excess well in advance of your brow lift and for 1 week after surgery. Drink lots of water in the days leading up to your brow lift. Hydration will help you recover more quickly. To make your recovery easier and more comfortable, be sure to arrange for someone to take you home and take care of you for at least the first 24 hours. Fill your prescriptions prior to surgery and place them within easy reach of where you will be resting. Place plenty of pillows or a bed wedge nearby so that you can keep your head elevated. Recovery: you should expect some bruising, swelling, and the feeling of tightness for the first several weeks. If you feel like you've lost sensation in the treated areas, don't be alarmed. As your nerves begin to regenerate, feeling and sensation should return to normal. Pain is moderate with this procedure, but a pain medication will be prescribed to control any discomfort. However, if you begin to have severe pain, contact us immediately. The recovery process is different for everyone, but within a day of your surgery, you should be up and walking around. Keep your head elevated for several days following surgery while applying cold compresses or small ice packs to help reduce swelling and discomfort. If you wear contact lenses, avoid wearing them until you feel comfortable doing so. For the first week, plan on being out of work and away from your usual activities. Following this period, you may gradually return to activities such as lifting, exercise, and sex. Avoid any high-impact activities for about 1 month. Stay away from saunas for a few months as the steam can affect healing. Although the appearance of bruising will fade gradually, you may notice some remaining bruises for as long as a month after surgery. Therefore, you may want to consider using special camouflage makeup as you heal. These precautions will help you avoid stress to your scars and allow time for your facial tissues to heal and recover. The appearance of your scars fades nicely with time and should improve over a period of several months. What are the risks of brow lift surgery? This information is not intended to frighten you, but to help you make an informed decision. No question or concern is silly or insignificant. We will be happy to discuss the full range of potential complications and answer any questions you might have regarding this procedure. Many thousands of brow lifts are successfully performed each year, and thankfully, serious complications occur infrequently. But they can occur. Complications can include, and are not limited to, damage to underlying facial structures, nerve damage, asymmetry, and eyelid disorders. As with all medical procedures, be sure to choose your surgeon wisely. It is important to choose an experienced surgeon you can trust and develop a good rapport with, so you can openly discuss your concerns and particular needs throughout the process of consultation, surgery, and aftercare. Should you decide to move forward with your brow lift, a surgery date will be scheduled. Prior to surgery, you will be given complete preparation and recovery instructions. Remember to keep your follow-up visits, as we are here to help make this a wonderful experience for you. Feel free to review any part of this presentation you like, and be sure to take a look at our before and after gallery to get a better idea of the results you may achieve.